Hallucinations with Parkinson's. This is a very scary topic for many patients and caregivers. Visual hallucinations, seeing things which are not there, could happen in about 20% of patients. And these are major cause of long-term placement of these patients into long-term care homes. There are many factors responsible for this. The drug-induced psychosis in Parkinson's is more common in elderly patients, and it could be triggered by medications which are needed to use for the treatment of Parkinson's disease. The visual hallucinations in patients with Parkinson's, they could be very detailed and they are sometimes well formed. And most patients are not frightened by the hallucinations. The auditory hallucination, like listening voices which are not there, are much less frequent as compared to visual hallucinations. Patients who have severe dementia, they may develop periods of confusion, especially at nighttime, sunset time or sundowning. So important things to keep in mind are patients should have adequate nutrition and a fluid intake. Also, the factors such as infection, dehydration, or impairment of vision or hearing should be ruled out. And patients should have a good nighttime sleep. At nighttime, if they're seeing shadows or something, they should turn on the light and they should switch off the television at nighttime if they're seeing any violent scenes. Also, the caregivers, they should not argue with the patient, but they could explain them gently that the hallucinations are not real and they should reassure them. Most patients would believe them. And repeated reassurance is absolutely essential to these patients with Parkinson's disease.